Intense work pace. Stressful life and psychological pressures negatively affect human health. For this reason, chronic fatigue, which is among the diseases whose incidence has increased in recent years, is a condition that occurs with problems such as the person constantly feeling exhausted and unhappy and not feeling well even with rest. Psychological and physiological treatment is required in people with intense chronic fatigue. Chronic fatigue is a psychological problem that manifests itself with symptoms such as people constantly feeling tired despite adequate rest, decreased work efficiency, reluctance and withdrawal from social life, and unhappiness. In some patients, it is characterized by only mild fatigue and low energy, while in more advanced cases, it can reach to the extent that the person becomes unable to perform even daily activities and is in need of some kind of care. Chronic fatigue syndrome is generally seen in people who have an intense work schedule, work in jobs that require a high level of responsibility, senior executives with a stressful work life, and employees who work long, tiring shifts. Although chronic fatigue syndrome is a very common problem, the exact cause has not yet been identified. This disease usually affects individuals between the ages of 30 to 50, and the incidence in women is much higher than in men. The majority of individuals suffering from the syndrome have muscle and joint pain, constant fatigue, and lack of energy for at least 6 months. Although the exact cause is unknown, there are some reasons that increase the risk of developing the disease. The most important of these is stress. Chronic fatigue can occur in people who are constantly under stress, whose work life is very busy, and who cannot spare enough time for themselves. With the formation of psychological problems and the negative impact on physical health. At the same time, factors such as lack of sleep patterns, sleeping in a bright environment at night, or decreased sleep quality due to reasons such as constant awakenings are among the factors that may play a role in the development of the syndrome. Contrary to popular belief, patients cannot overcome the feeling of constant fatigue no matter how much rest they get. For this reason, patients with persistent fatigue for more than 6 months should definitely apply to health institutions for psychological and physiological support. The symptoms of chronic fatigue are similar to those of short-term stress and fatigue, so they can be confused with them. Not every individual who feels tired and exhausted is suffering from chronic fatigue syndrome. In order to diagnose the presence of this syndrome, patients should be examined by specialized physicians. Common symptoms of chronic fatigue syndrome are as follows: constant fatigue and sleepiness, muscle and joint pain, sore throat, abdominal pain, energy loss, nausea and vomiting, forgetfulness and decline in cognitive performance, disturbances in sleep patterns and quality, weakening of the immune system, disorders of bowel regularity, negative attitudes towards work and social life, constant restlessness, depression. There is no definitive treatment for chronic fatigue syndrome. The treatment plan is usually determined by the individual and the severity of the problems the patient is experiencing. The most effective methods to cope with the syndrome are measures such as exercising regularly, improving the patient's ability to combat stress and solve problems, and alleviating busy work schedules. If the disease does not seriously affect daily life, and the patient is able to carry out daily activities, medication may not be necessary. However, antidepressant medication may be necessary in patients who experience the syndrome in a very severe way, face the risk of losing their job due to this, or are in the process of depression and have completely withdrawn from their social life. In the psychological treatment process, cognitive therapy can be applied by giving information to patients about changing negative emotions in a positive way, recognizing and combating stress factors, spending more time on activities and hobbies that people with the syndrome like to do. Determining a regular exercise plan and adapting to it are also very effective in eliminating the disease. If you are facing serious problems in your social life and business life due to the feeling of constant fatigue, and you are wondering how to relieve chronic fatigue, You can get medical support by contacting a health institution immediately if your disease is diagnosed as a result of chronic fatigue tests and examinations. You can start your treatment process immediately and prevent more serious problems that may occur in both your daily and business life.